According to Singapore Management University's Centre for Research on Successful Aging, seniors who are less educated and have less social contact are more likely to be holding off on the COVID-19 vaccine. The study was conducted last month, and at that point, 16.26% of those aged 71 to 75 hadn't received their first dose, higher than the other age groups studied. Well, on a related note, have a look at this chart released by the Health Ministry last week on the progress of our vaccinations. Paying attention to the dark grey line, despite being the first age group to be offered the vaccine, seniors 70 years old and above currently have the lowest take-up rate, plateauing in the past month. Well, since January, 14,000 volunteers and staff from the People's Association have been going door to door to talk to the elderly about vaccines and address their concerns.
How are you?
Fine.
Have you taken your lunch?
Yeah, eaten.
Eaten, Up there, makan already?
Makan already.
Usually we will visit residents to find out if they need any help or if they've got any queries, especially the senior citizens in the Boon Tiong precinct. I have been talking about vaccination to the senior citizens here since the beginning of this year. Some of them actually are worried, whether they are suitable at their age or with their health conditions or their allergies, whether they're suitable, for vaccination or not. Yeah, and some of them also have a fear of injections. Yeah, so these are the more difficult ones because with a fear, it's very difficult for us to help them to overcome this fear. Some of them mentioned that they are not aware of whether they're suitable because of the medication they're taking or the allergies that they have. We would encourage them to visit their doctors as soon as possible, clarify with the doctors whether they are okay, to do the vaccination. I'm quite a chicken because I'm really afraid of, injections, even taking blood samples, that kind of thing. So actually, I deliberated a while before I went for my vaccination, but because I really want to experience it so that I can actually share with my senior citizens, so I went ahead anyway. When I visited you, you mentioned that you're a bit scared because diabetic.
Then what did he tell you?
He said, don't scare. Then my doctor also scolded me, no need to scare, you go mommy.
Actually, I intend to wait and see, that type of attitude, wait and see. But then he came and said, why you don't go for vaccination? So I did follow up. I said, you can call the CC.
It's actually very important because I think a lot of seniors, they are not aware. They don't have very up-to-date information. They are also not aware of what is available, what is there for them. So as such, we can reach out to them to share with them more so that they can, make a better informed decision.
My colleague, journalist Timothy Goh, shadowed that door-to-door round. He joins me now. Welcome to the show, Tim. So, some elderly residents haven't gotten their doses for reasons like a fear of the vaccine or injections, as well as a wait-and-see mentality. You spoke to other seniors, though. Why haven't they been vaccinated?
Thanks for that. Well, there's quite a number of reasons, actually. So some of them, it's as simple as a fear of needles. For others, they feel that they're already so old and they have other chronic conditions, so there's not very much of a point in taking the vaccine. A very small group are holding up because of religious reasons. They believe that if they catch the virus, it's meant to be. And some others feel that the vaccine may not be compatible with their own medical conditions. And even though, there are resources out there that actually help to dispel some of these notions, in some cases, I get the sense of inertia from them that they just don't really want to find out. And still others are saying that, the pandemic's not so bad. It's going to blow over. There's no point in taking the vaccines.
Right. Well, to counter all these reasons, Health Minister Ong Ye Kung said a bigger push will be made to encourage more seniors to get jabbed. What incentives, though, could be possible, Tim?
There are a number. Some experts I've spoken to have suggested perhaps a lucky draw or some goodie bags, although they've pointed out that using this might breed the sort of mentality where people expect to have rewards for doing the right thing. So that may not be the best option. Some others have suggested simpler messaging, using very simple language, infographics in vernacular languages. But for me personally, after speaking to the seniors, I feel that the most important thing that could get them to be motivated is family members. And that would be family members or close friends playing the role of ambassadors, talking to them trying to understand their concerns and explaining that it's important that they get vaccinated. Because for a lot of these old folk, honestly, they may not want to listen to what the government has to say or to what scientists have to say, but if their own grandson or granddaughter or even son or daughter-in-law says it to them, they might choose to go for the jab instead.
Right. Well, thanks, Tim, for coming on the show. I've been speaking with journalist Timothy Goh. Now, he's done several stories on seniors and COVID-19 vaccinations, which you can read over at straitstimes.com.